Hey everyone, welcome back to Trove Direct. In the heart of sub-Saharan Africa, where the sun dips below the horizon painting the sky in fiery hues, a seemingly innocuous mosquito's buzz can signal far more than mere annoyance. It's a sound that carries a chilling undertone, a potential harbinger of something far more sinister. It can mean malaria, a deadly and persistent threat, particularly to the vulnerable population of children. This parasitic disease casts a long shadow over communities, disrupting lives and futures. Malaria's insidious parasite launches a full-scale assault, targeting and invading red blood cells, hijacking their function for its own propagation. In the most severe cases, this parasitic invasion can escalate dramatically, sometimes blocking the vital flow of blood to the brain. This triggers a cascade of devastating consequences, leading to cerebral malaria, a life-threatening medical emergency that demands immediate intervention. Children, with their still developing immune systems, are particularly vulnerable. They can slip into a coma with alarming speed, sometimes within a matter of hours, as the parasite overwhelms their defenses. This rapid decline leaves families and dedicated doctors locked in a desperate and agonizing race against time, battling to save young lives from the clutches of this relentless disease. Every second counts in this critical fight. The primary and most crucial treatment strategy revolves around the administration of anti-malarial drugs designed to target and eliminate the parasite from the bloodstream. However, accurately diagnosing the full and complex clinical picture presents a significant challenge, often complicated by overlapping symptoms and limited resources. The symptoms of a coma in particular can frustratingly mimic those of other severe and potentially life-threatening bacterial infections, such as sepsis or meningitis, adding layers of complexity to the diagnostic process. This overlap makes it exceedingly difficult to definitively determine whether malaria is the sole culprit, or if there's a hidden bacterial infection simultaneously exacerbating the patient's condition, demanding a different course of action. In resource-constrained settings where advanced diagnostic tools are often unavailable, doctors have historically been forced to rely on their clinical judgment and experience, leading to a degree of uncertainty. The critical question lingers: is it solely a case of malaria, or is there a coexisting underlying bacterial infection that requires immediate and targeted treatment alongside the antimalarials? This persistent diagnostic uncertainty has profoundly shaped treatment protocols and medical practices in the region for decades, influencing the approach to managing these critically ill patients. This has often led to a cautious and broad-spectrum approach, where doctors may prescribe multiple medications to cover all potential bases, erring on the side of caution in the face of limited diagnostic clarity. In the face of uncertainty and the critical need to act swiftly, doctors have routinely given antibiotics. This was seen as a necessary precaution, a way to cover all bases when dealing with potentially life-threatening illnesses. This practice extended to administering antibiotics alongside anti-malarial drugs to comatose children, a common approach in regions where both malaria and bacterial infections posed significant threats. This practice, born from caution, the urgency of the situation, and often limited resources, became deeply ingrained in medical protocols. It became standard across Africa, and in many ways beyond, influencing medical practices in resource-constrained settings worldwide. Blood cultures, the gold standard for definitively detecting bacteria and guiding targeted treatment, take days to yield results, a significant amount of time these critically ill children simply don't have. Every moment counts in such situations. So, in the absence of immediate diagnostic certainty, antibiotics were often given just in case, a preemptive strike against potential bacterial invaders. And this approach, driven by the best intentions and the need to act quickly, was widely taught as best practice in medical training programs. But the real question lingered beneath the surface of this established protocol. How many of these vulnerable children actually have a bacterial infection that warrants antibiotic treatment? And perhaps more importantly, do antibiotics really provide a tangible benefit in all these cases, or are they being overused? As antibiotic resistance became an increasingly alarming global concern, threatening to undermine the effectiveness of these life-saving drugs, this long-standing routine, this deeply ingrained practice, was finally put to the rigorous scrutiny of scientific testing. In July 2025, a landmark study emerged, challenging decades of established medical dogma. This groundbreaking research questioned the conventional wisdom surrounding the treatment of malaria-induced coma in children, a practice that had been in place for far too long. The study focused on over 1,600 children suffering from malaria-induced coma, a severe and life-threatening complication of the disease. These children, already battling a formidable illness, were at the center of a critical investigation. The clinical trial was meticulously conducted in Uganda and Malawi, two countries where malaria remains a significant public health challenge. The rigorous design of the trial aimed to provide definitive answers. The children were divided into two groups. One half received the standard anti-malarial treatment in conjunction with antibiotics, a common practice at the time. The other half received the same anti-malarial treatment but were given a placebo instead of antibiotics, allowing researchers to isolate the true impact of antibiotic use. The results, once analyzed, were undeniably clear. The survival rates and overall recovery rates were statistically the same across both groups, indicating no significant advantage from antibiotic use. This held true whether or not antibiotics were administered as part of the treatment protocol. The data challenged the long-held belief in the necessity of antibiotics. Further analysis revealed that only about 1% of the children enrolled in the study actually had a confirmed bacterial infection alongside malaria. This means that for every 100 children treated with antibiotics as a precautionary measure, a staggering 99 children received antibiotics unnecessarily, exposing them to potential side effects and contributing to the growing problem of antibiotic resistance. The weight of the evidence was undeniable, pointing towards a critical reevaluation of current practices. The study strongly suggested that routine antibiotic administration offers no tangible benefit for the vast majority of children presenting with malaria-induced coma, challenging the status quo in pediatric intensive care. This groundbreaking finding calls for a major shift in established pediatric care protocols and a more judicious approach to antibiotic use in these vulnerable patients. Unnecessary antibiotics aren't harmless. They fuel antimicrobial resistance, a global health crisis. Each needless dose helps bacteria evolve into superbugs that our medicines can't defeat. For families, this means future infections could become untreatable. The study's lead authors stress, preserving antibiotics for true bacterial infections is vital. Continuing the old practice risks making essential drugs useless, especially where new antibiotics are scarce. The benefit of routine antibiotics is minimal, but the risk to public health is immense. The focus must shift to targeted, evidence-based treatment. The message is clear: stop routine antibiotics for every child in a malaria coma. Instead, use antibiotics only when there are clear signs of bacterial infection. This demands better, faster diagnostics and urgent priority for hospitals across Africa. For parents, not giving antibiotics is now a sign of up-to-date, evidence-based care. These findings will shape new guidelines and smarter treatment worldwide. By reserving antibiotics for those who truly need them, we protect children today and safeguard these medicines for the future. Sometimes, the greatest medical advance is knowing when not to act. Don't forget to like, share, and subscribe to the channel.